and addiction medicine specialist. Currently, I work as medical director for a health plan. As the indigenous people of Oceania, it is my protocol to pay respect to the land we are on. I must acknowledge the sacred land we stand on and the original people that the land belongs to. On behalf of the Southern California Pacific Islander COVID-19 response team, I pay respect to the sacred land that I am on in Los Angeles and its original Tongva people. We humbly ask for permission as we continue our program, acknowledging that in this work, we recognize their presence and that of their ancestors. I want also to pay respect to our elders and recognize that we serve because of the sacrifices they have made. We hope that they can carry forth their legacy in serving our Pacific Islander community and humbly thank them for their wisdom and teachings. Today is an offering from the SoCal Pacific Islander COVID-19 response team's community engagement work group, along with lead Heidi Cuenga, with technical assistance from community volunteers, Mickey Davis, Janice Leon Guerrera, Tia Tevaisu, and Kelani Silk. The event is sponsored by the Asian American and Pacific Islander Civic Engagement Fund, a project of Neo Philanthropy Incorporated through EPIC based in Los Angeles County. And I apologize, Tia. The Southern California response team is made up of Native Hawaiian and Pacific Islander researchers, health experts, faith-based community leaders, volunteers, and advocates formed to plan and implement infrastructure informing and supporting families and communities about the coronavirus, SARS-CoV-2, or the infection COVID-19. Our SoCal Regional PERC is part of the national response team made of regional response teams connecting all of this important work to their respective communities in Arizona, Arkansas, Northern California, Southern California, the capital to include Washington, D.C., Maryland, and Virginia, Hawaii, Oregon, Utah, and Washington State. We hope that you will stay on for the entirety of our program today, which will run as follows. Following my remarks, there will be an invocation. We will feature a presentation for our veterans in understanding the COVID-19 vaccination rollout process and additional resources that are available. Following the interactive presentation, you will have a chance to ask questions during the Q&A portion of our program. Feel free to type questions into the chat box, as our team will be monitoring the chat box on Zoom and Facebook to ensure we answer as many questions as possible. As a reminder, we have VA regional representatives to answer your specific VA questions live. With that said, we ask for your utmost respect of this gracious space that we are sharing together this evening. Before I ask Pastor Lynette to provide the invocation to open up our program, I'd like to tell you a little bit about her. Pastor Lynette Fuka is an ordained elder of the Free Wesleyan Church of Tonga. She previously worked for the United Methodist Church. Currently, she is a chaplain at Providence Hospital in San Pedro, California. She is married with 4 children. Pastor Lynette.
Hello, everyone. At the hospital where I work, we have a morning and evening prayer. And this is one of the prayers that I use at one of the evenings. And it's a prayer in times of this pandemic by Cameron Bell. May we who are merely inconvenienced remember those whose lives are at stake. May we who have no risk factors remember those most vulnerable. May we who have the luxury of working from home remember those who must choose between preserving their health or making their rent. May we who have the flexibility to care for our children when their schools close remember those who have no options. May we who have to cancel our trips remember those that have no safe place to go. May we who are losing our margin money in the tumult of the economic market remember those who have no margin at all. May we who settle in for quarantine at home remember those who have no home. As fear grips our country, let us choose love. During this time when we cannot physically wrap our arms around each other, let us yet find ways to be the loving embrace of God to our neighbors. Amen.
All right. Give me just a minute. My apologies. Wait, where do we go? Oh, sorry about that. Thank you, Pastor Lynette, and I'd like to now introduce you to Dr. Jane Kim. I would like to introduce Dr. Jane Kim. She has been the VA National Center for Health Promotion and Disease Prevention, VHA Chief Consultant for Preventive Medicine since August 2016. She joined the VHA as the Deputy Chief Consultant for Preventive Medicine in 2013, arriving from the Durham, North Carolina Veterans Administration Medical Center, where she was a primary care provider since 2005 and Women's Health Medical Director. Dr. Kim continues to be a part-time primary care provider at the Durham VAMC, as well as an associate professor in Duke's Department of Medicine. Dr. Kim received her medical degree from the University of Maryland School of Medicine, MPH from UNC, and completed internal medicine and preventive medicine residencies at Duke University and UNC. She is a lead for the National COVID-19 Vaccine Planning Team with expertise in the current COVID-19 vaccines authorized by the FDA and the VA's distribution approach. She can speak to the concerns about COVID-19 vaccination, including whether the vaccine is safe and effective. Dr. Kim.
Thank you so much, and welcome. Thank you for having me today. It is my pleasure to talk to you about COVID vaccines and how the VA is rolling out COVID vaccinations throughout our network of sites, including the Pacific Islands. So if we can go ahead to the next slide. I will have an overview here for those of you who are veterans or have veterans in your families or have an interest because you have friends or colleagues who work for Veterans Affairs, but I hope this will also give you general information as well about COVID vaccines, and I want to leave plenty of time for questions. So I wanted to first give you an overview of the vaccines that we are sending across VA and that I hope are reaching you as well. So in terms of what VA is doing in terms of receiving vaccines and giving them to our patients and staff, we have given and almost 1.3 million doses for first dose of vaccine for our veterans and staff. And for many of those, almost 768,000, we have given a second dose, which completes the series. So out of a total of a little over 6 million staff and veterans, most of those being veterans, we have already made great progress given that these vaccines just became available in December. Just to let you know, we also monitor the safety of these vaccines very closely, as I know this is being monitored across the country, and have not seen significant adverse events that would make us concerned that these vaccines are not safe. In fact, the rates of adverse events are quite low, and there have been no significant safety signals to date. So that is great news. Next slide. Of course, with many things and us being a very big healthcare organization, we are closely monitoring how we're doing with vaccination and very interested in not only how many doses we're giving to our staff and veterans, but also how we're doing in terms of veterans of different races and ethnicities receiving vaccination. We want to make sure if there's any disparity with less people receiving vaccine, that we make sure that we take care of that and reach out to those veterans and or staff who may be falling behind with vaccination. So I did want to point out here that we are tracking Native Hawaiian and other Pacific Islander among our veterans, and have noted about 7% of those have been vaccinated already, which I think is good. It's tracking with where we are with the overall population of veterans and those who are Native Hawaiian or Pacific Islander. And in terms of how many, what percent of Native Hawaiian or Pacific Islanders are refusing vaccine, it is about a third of refusals that we see, but that tracks with about the same in each race, say among whites, a little less than a third, about 26% are refusing. Among blacks, 29% are refusing. So not too significantly higher a refusal rate compared to other races. So that is good news too, because if there were many more refusals in one race than another, we would be worried and think maybe we need to have a talk through why they might be hesitant. So we will continue to track that closely. Next slide. So you might be wondering, how have we gotten to this point to vaccinate thousands and now into the millions? We had to talk a lot as we planned for this effort last fall, and as we continue, we needed to have open conversations with our staff and our veterans to tell them what we think is going to come, what the vaccines we think will do for you. Are they safe? Are they effective? How do we get all this information out to a very large network of hospitals and clinics across the country and through the islands? So we did a lot of talks, talked to a lot of people, and still continue to talk. Communication is key, as I'm sure you know. Unless you tell and have a conversation about things, how would you ever know? So we made that a priority. We did develop a lot of documents and tools to help people give these very complex vaccines. It seems like this is just a vaccine like any other, right? But it is actually much more complicated than any other vaccines we've seen. These vaccines are very difficult to store and handle. And once you get it in the syringe, it's easy. But everything else to that point is extremely challenging. How do you even get vaccines which require ultra cold, dry ice conditions to an island? So all of these things we had to think through well in advance and decide how we were going to approach them. What we did as we went along is we shared our best practices among our network of sites. Some places had a lot of great ideas from, say, flu vaccination that we said, that's great. How about we adapt that for COVID vaccination? And so we shared a lot across our whole national network to make sure that if there was a best practice, we all learned together. Next slide. So to give you an idea of where we are now, if you look from the left side at 0.0 on the bottom line of the graph, that is really December 14th, when the first COVID vaccine that was authorized by the FDA, the Pfizer vaccine, became available. So that is day 0 when we did not have any vaccine. The first vaccines were given to healthcare personnel, that is what HCP stands for, as well as those who live in the long-term care facilities, because nursing homes have been seen to be unfortunately very hard hit by COVID, and many of those individuals unfortunately have died. So we offered the first vaccines to those two groups. After that, we are currently in phase B, where you see the red X. That is mainly our elders, our 75 and older population. They are very vulnerable to become very sick and to die from COVID. So because that is known, the vaccine is being offered to our oldest veterans to make sure we protect them first. Another group that is being protected is frontline essential workers, such as those who do our sewer, our water, those who are teachers, those who are police. They have been serving us throughout this pandemic, and to offer them vaccine offers them protection and helps keep our society going. As we go throughout the spring, you'll see the bigger blue bump here is phase 1C, which is also some more of our oldest veterans, but a little less old, 65 to 74-year-olds. And we have already started to vaccinate quite a few of these, but as the spring moves on, we will vaccinate more and more. And also those who have high-risk medical conditions, such as heart disease, diabetes, and lung disease. With these conditions, you have a higher risk from becoming severely ill from COVID-19. So because we know that risk, we are going to and already have been offering vaccine to these veterans as well. Phase 2 on the far right is when probably sometime this summer, there will be plenty of vaccine for everybody, younger people, not children though, but just adults, and pretty much anyone who would like a vaccine can get it. So I will think when we reach that day, that will be fantastic. but currently we are kind of doing these vaccines in a phased approach because there's just not enough to go around. And so because of that, it's being offered first to those who are at highest risk for severe disease and death to make sure that they are the first to be protected. Next slide. So this is just giving you a graphic of and more information about what I just told you. It's here for your information, but what VA is doing is what the Centers for Disease Control and Prevention is doing in terms of, it's called a phased approach to vaccine distribution. So VA is not really doing anything radically different from what the CDC is recommending. We have a very small kind of minor changes within this, but the core principles of offering vaccine to those who are at highest risk first remains. The ethical and equitable distribution of vaccines is really the highest priority. And so because those who are at highest risk really warrant the vaccine first, we are currently offering it to those highest risk individuals first. Next slide. So you might be wondering, how is the United States doing with COVID vaccination? So we are doing quite well. If you want to check, the CDC has this information on COVID vaccines administered throughout the United States. And so if you look here, and then this is just a sample of what you can find if you just Google COVID vaccine CDC, you can find it pretty easily. Even I can find it. And so you can find out progress even by state and by island of how COVID vaccination is going where you are. And so this continues to change. We are doing better and better with getting vaccines administered throughout the country. And so lighter means, I think, less people per capita have been vaccinated, and darker means more. I think we are approaching getting darker and darker here, which is a great thing. It means more people have gotten vaccine. So if you're interested, I just encourage you to check this out if you would like to see how your state or territory or island is doing in the context of the whole United States. Next slide. So this is a very busy slide. All I wanted to tell you here is to emphasize the point that the two vaccines currently available, which are on the left, Pfizer, BioNTech, and Moderna, those are the two vaccines which you can get now. They are very similar to one another. They use similar technology, which is mRNA. They are both 2 doses, and they both work really well to protect people against severe COVID disease. Fantastically well. I don't think we have ever seen vaccines work this well before. They are safe. In tens of thousands of people, there were no significant safety issues, but I will say they do have side effects. I myself got my vaccine in December and January. My arm was sore, but that was it. So I hope if you get your vaccine, you will have as few side effects as I do. But if you have a side effect, we know that people feel tired, headache, they might feel muscle ache, chills, but those side effects typically go away within 1 to 2 days. And they sometimes keep someone out of work or their daily activities, but a lot of times it's just bothersome and goes away. What is coming, hopefully, are 2 new vaccines against COVID-19. One is made by the Johnson & Johnson company. We expect if that vaccine is FDA authorized, it may become available as soon as March. This is a great option to be able to be transported far and wide. It is a refrigerated vaccine, and it is easy to transport, I think, by plane, hopefully, and over long distances, and to store in a regular refrigerator. So maybe in an island setting, it would work well to transport there and store there. The other 2 vaccines, the Pfizer and Moderna, are very difficult to store. They require very special freezers. You have to time very precisely when you dilute and put the vaccine in a syringe and give it. The Janssen vaccine is not as strict from what I understand. It is more like a regular vaccine, like flu vaccine. You can put it in a refrigerator, take it out, put it in a syringe and give it, just like most vaccines we have. So if that comes available, of course, the science to make sure it works and is safe and effective needs to be reviewed, but that I think potentially is a great option to be able to transport. The other vaccine, which may come maybe at the end of March if FDA authorizes it, is made by Oxford AstraZeneca. That is also refrigerated. It is a 2-dose vaccine, but again, transport of this vaccine I anticipate will be much easier than the Pfizer and Moderna vaccines. So stay tuned for those two. The more people we can get vaccinated in our communities, the sooner we will get through this pandemic, because it will halt the spread once we reach herd immunity of the virus. And so I think we all want our communities to be safe. By each of us getting a vaccine, we help us get there. Next slide. So you might have heard about these COVID vaccine, COVID variants. Not the vaccine, it is just the actual virus. So these are pretty much mutations of the SARS-CoV-2 virus, the virus that causes COVID disease. The main ones that are circulating now in the world are listed below. I will say that the main concern, besides the fact that they seem to be more easily transmitted from person to person, is will the vaccine still work against them? So far, this has been studied mainly in laboratory studies, and it looks like all the vaccines that we have, the Pfizer, Moderna, and even the ones that are currently in review, not yet authorized in the US, still work against each of these variants, which is good news. They do work to prevent, in laboratory studies, the virus from replicating. I think the thing that we are not sure is how that may protect people from getting sick, and what does it protect you from getting severely ill from any of these variants. So far, it looks like the vaccines do protect some, but how exactly that'll play out in terms of how it'll protect people in real life is unclear yet. So more to come. I think know for sure though, is that the more people we can get vaccinated and the sooner we can do it, it's a race against these variants. The sooner we can get people vaccinated, we can kind of get ahead of the variants and prevent them from spreading. So I think the bottom line is, if we think the vaccines work, get your vaccine, and hopefully we won't have to deal with these variants because we'll have enough herd immunity that we'll have kind of controlled the pandemic that way. So, but I'm sure we'll be hearing more about this in the spring. Next slide. I wanted to mention that with the new presidential administration, there is a comprehensive White House national strategy for addressing COVID-19. So one of their goals is to mount a safe and effective and comprehensive vaccination campaign. And they're really looking at a number of things that are really important, especially with this pandemic being at a hinge point with these variants coming to the United States and spreading. I did want to mention a few things here. This really gets at the process of vaccination and just the importance of having a program, not only to get shots in arms, but also to monitor the data and make sure people know about vaccines and that they are safe and effective. I wanted to say equity is a key consideration here. As we know, certain populations have been really hard hit with COVID, especially the elders. And so the current administration really wants to make sure vaccine is available to those communities, especially in order to protect them, especially the older individuals there. I do want to say sometimes it is hard to get vaccine to those communities, but that doesn't mean it shouldn't be tried in whatever way possible. So I am so glad to see that the new administration is highlighting the importance of equity and is making a lot of effort to get vaccine close to where those of minority communities are, to make sure that they have good access to vaccine. Next slide. So if you are a veteran, I encourage you to just go to va.gov, easy to remember. At the top of that page, it says, if you're interested in COVID vaccines, click here. And what it does is take you to a whole page with questions and answers about COVID vaccines in general and some specifics about how VA is offering COVID vaccines in its network. If you are a veteran, you can certainly sign up to get updates, like you sign up, to get on mailing list for a store or something. You can sign up for VA COVID vaccine updates, and the tool is called Keep Me Informed, and it's right on that COVID vaccine VA page. And that way you can get updates. And if you're a veteran who gets care with us in VA, you can actually tell us if you're interested in getting vaccine, and your information will be sent to your facility or clinic where you receive care, and your clinic or facility may then just pull you off the list and say, it's your turn. So it's a good option to indicate your interest if you're a veteran receiving care with us. And if you have veterans in your community who get care with us who might not know about this, let them know. They can just sign up right here. It is pretty easy. It takes a minute to fill out. Over 500,000 veterans have responded to this, and 3 messages have been sent out, and I think more to come. So I encourage you to check that out. Next slide. All right, so in case you wanted to know more, I guess the websites that I just described to you at va.gov has a lot of resources, just in terms of if you have general questions about COVID vaccines, who are we vaccinating now in VA? How does that work? So I encourage you to check that out. If you get these slides, there are some links here as well if you want to check it out directly, or as I said, va.gov has some links, and then we have additional ones too. If you're a reader, plenty to read here. So I encourage you to check these out if you have an interest. Next slide. And again, a lot of press has gone out about our COVID vaccine campaign. Given that we are so distanced these days, we've put out a lot of media releases to make sure that the word is out about VA's offering vaccine and where we're offering it and who it's available for now. So I just wanted to highlight that a lot of media articles have gone out as people are still tuning into the news, I hope, to see what's going on. Hopefully you've maybe seen a story about your VA near you offering COVID vaccines, and just the great work that's going on all over our country and our clinics. People are working really nights and weekends in snowstorms and hot weather, doing extreme things like flying vaccine to make sure that our veterans have the opportunity to get this vaccine and get protected. So I'm just really proud of our entire hundreds of thousands of VA employees who are working to make sure that we get the shots in arms, given that we know the variants are around, and we all want to get through this pandemic as fast as we can. Next slide. And again, we have really thought about minority communities and how some of them might not trust this vaccine. They have not had a good history with science and scientific studies in their community. And so we understand that and have created some materials to help have conversations, whether it be veteran to veteran or staff to veteran or staff to staff. How can we just have a conversation around this and find out why people are saying, I don't want to get it, or I think I want to wait until someone else gets it. Are they worried that it's safe? Are they worried that it was not tested in their community? So these just give information to have the conversation. I don't know if a flyer ever convinces anybody, but it can help to give the information in the context of a person-to-person conversation, which I think is really the most effective. If you have one of our staff members who's a nurse and they talk to one of their patients and the patient is saying, I don't want to be vaccinated, they can have a conversation. And because the patient trusts the nurse, I hope that their mind would change. So just wanted to highlight the great work our team has done to produce these materials to help us all have these conversations. Next slide.
All right, thank you, Dr. Kim. And I'd just like to appreciate your work and the service of all the veterans who you serve and who are present during our talk and in the community. We need to pause for a minute so that we can start the Facebook. So I guess I'm gonna ask a couple of questions maybe or at least a couple of questions maybe to Dr. Kim which you don't have to answer right away, but maybe to think of if they aren't asked by other people. So my first question would be, is there any difference in the vaccination rates or vaccine hesitancy between Native Hawaiian Pacific Islander veterans on the continent and those in the island territories? And then the second question would be, are there any specific campaigns which are reaching out to Native Hawaiian and Pacific Islander veterans, particularly in Pacific languages? And I'm not sure whether or not I have been speaking to enough. I'm not sure whether we're ready to take questions. I'm waiting for.
You can continue.
Okay, all right. So those are the questions that I have, but it's really an amazingly admirable job that the VA has done in 1 million vaccinations in such a short amount of time. Here in California, I believe Governor Newsom has just announced that there's been about 6 million vaccinations given, one of the highest actually in the world. But I'd be interested in your thoughts about, specifically tailoring campaigns to reach Native Hawaiian and Pacific Islander veterans, and whether or not there's difference between people who live on the continent and who still live in the islands.
Right, those are great questions.
And I apologize for my cat.
No, I wanted to just highlight that we have the most data on our Honolulu, Hawaii population. They contain one of our hospitals as well as a set of clinics on their islands. And so I know we were able to directly ship them vaccine to administer to their staff and patients. And I'm just looking over here because I pulled those numbers earlier today. They have vaccinated almost 5,000 veterans. And among their staff, they have vaccinated quite a few as well, more than 1,000, which is almost 68% of their essential personnel in their healthcare system. So that is terrific. The more that the staff are protected, they actually stop bringing COVID-19 into the facility to the patients. We saw that in some studies that CDC did, just some modeling to show that if you vaccinate the staff, it is highly protective of those who they serve inside the hospital or clinic. So I was very encouraged about that. I think in terms of the question of how we're doing in the other islands where we have clinics such as American Samoa, Guam, the Commonwealth of the Northern Islands, that I think is still evolving. I'm going to be very honest. It has been a big challenge to get vaccine to those islands, as you can imagine, especially because Pfizer and Moderna are so hard to ship. What we did is talk with CDC and said, hey, we have these clinics here. They serve our Pacific Island staff and veterans. We're not sure if we can get them these special vaccines, but someone must be getting them vaccine. What should we do? So what we did is we partnered with the jurisdictions, Department of Health on each island, and they, in many cases, were willing to offer our patients and staff vaccine because I think they all just work together there. They have to. I will say American Samoa, we are working on a partnership. I'm not sure if they have vaccine yet. They may just be getting it, but they asked for VA to help them with staff who can provide the vaccine. And so we're hoping if we partner together with them, our staff and veterans can get vaccine as well. So we're trying to be very creative with that because the Pfizer Moderna vaccines are so hard to ship. We did talk with the islands and they were agreeable to help us, and it's in American Samoa, they hopefully it's in return for us helping them vaccinate the population there too. So I think more to come. We are still working that out. Those populations are very important to us, just a little more challenging for us to ship vaccine to, but we're getting there. And like I said, with the Janssen vaccine, I hope that will be very easily shippable to islands and that will be a great product. It's a one-shot vaccine. My husband said he would get it because it saves him another shot. So it might be preferred by some people too. So we'll see how we do if that product gets authorized.
All right, well, I'm happy to say we actually have two questions from the audience. The first question is, there's been lots of talk about vaccine shortages. What happens if someone isn't able to get the second dose of either the Moderna or the Pfizer vaccine in a timely fashion?
Yeah, that is a great question. You are right that some places have run out of the second dose of vaccine. We think that, and that's in some states and jurisdictions, we think it's because they got really excited about getting the shots in arms, and then they might have forgotten that some of the doses they get are really for the second dose that is due in about a month. And then they're waiting for the next supply, but it might be a while. So the CDC, I think, recognized that and said that it's okay to wait as long as 6 weeks instead of 1 month. You can wait 6 weeks between vaccines doses, and that would be okay. But even if you have to wait longer than that, they said just give the second dose, and you don't have to do anything else special. You can just call the series complete and keep on going. So even if there's a more severe delay because of a shortage of supply or something like that, or maybe with these storms, a lot of things may happen to get things off schedule. It's okay to delay the second dose. Of course, it's not optimal, but if it happens, you can just give the second dose and not have to worry about getting another dose after that.
Thank you. And another question from our audience. Some of my family are worried about the side effects being portrayed on the news, and few of them that the vaccine will hurt them. What's the best way I can explain to them that the side effects are normally not as bad as they are seeing on the news?
Yeah, I think the news likes to make exciting stories. So I will just say that is number one. Number two is that if it makes them feel better, these vaccines were studied in these two Pfizer Moderna vaccines were studied in tens of thousands of people, a lot of people. And as you saw from the CDC website, have been given to 70 million people already. So a lot of doses have been given, and we have not seen significant effects to make us really worried that you're going to become so ill that you will become incapacitated. I would say, I tell my patients and my family, wouldn't you rather have the vaccine and maybe have a side effect for a day or two and feel a little under the weather, but then get better and realize I wasn't sick, that was just my body getting protected against COVID. I would much rather have a little side effect like that than to get sick from COVID, which can put you in the hospital and you can die from it. That is not going to happen if you get this vaccine. If anything, you may feel bad. Maybe you'll feel really bad, but just for a day or two, and then it'll get better. Especially with our parents, our grandparents, I cannot emphasize enough, they are so vulnerable to getting really sick from COVID. They really have very little defense. It is heartbreaking that our oldest individuals have been so severely impacted by this. They're the ones who should be the most protected in our society. So when I see that, I say, can't we all just get the vaccine to protect them? If they're afraid of it, protect themselves too. We want them around. So I hope that helps people. I know some people have heard the myth, which at first when I heard it I thought it was a joke, but it actually is real. People are saying, this is made of some kind of DNA thing, this RNA, won't it get inside my body and make me a different person? But people really believe that. And I just tell them it is an mRNA vaccine, but it is a very small part that doesn't mutate into your body and cause anything else. It just makes your body recognize the one small part of the COVID virus that you need to get an immune response from, and that way it can give you protection. But as soon as it gets in your body and your body makes that protection, that mRNA degrades, it goes away, it disappears. And so there's no risk of you getting mutated by a vaccine. So it just takes some talking through. Some of the materials I showed have those points as well if you need kind of that information in front of you. But just helping people realize that this vaccine was tested not just among whites, but among Asian, Pacific Islanders, Blacks, Hispanics, And among all those populations, it was found to be safe and effective. That helps people as well.
Great. Well, one of the other ways when I talk to people about it is the more reaction you have, the stronger your immune system is going to be potentially against the coronavirus. So it's actually, we know that the younger people tend to get more severe reactions because their immune systems are stronger. So just another way of thinking about it. But we do have another question from the audience, which is, it is recommended to stick with the same manufacturer. Is it okay to get a different manufacturer if we can schedule it because of a shortage? And I think this is only referring to the Moderna and the Pfizer vaccines, which are the 2-dose vaccines.
Right, so you should get the same manufacturer for your dose 1 when you get your dose 2. They should be the same. That is the, getting the same manufacturer for dose 1 and dose 2 is what was studied in the clinical trials and what we know works to protect people against severe or symptomatic COVID disease. That being said, sometimes it happens that you get 1 dose from Pfizer, and then for some reason you get 2nd dose Moderna, maybe a mistake, maybe something happened. So if that happens, CDC said it's okay. It's okay, you have to report that it happened, but they don't anticipate it's a safety issue. But they will closely monitor those people to see if there's any side effect or things like that. So if it happens, no need to worry that your life is ruined or something bad will happen to you. It has happened, and I have not heard of anything really bad in terms of effect. Like I said, if you are facing a shortage and are thinking, should I just go ahead and get the other vaccine? I encourage you to wait, because I think getting the same vaccine from the same manufacturer for your dose 2 is the best thing that you can do. And I would advise my family, if they're in that situation, why don't you just wait another week or 2 to get the same manufacturer if you can.
Okay. I actually need to apologize. I forgot my one-on-one discussion. So I have some questions that I'd like to ask. Should veterans get the vaccine by any means? That is, if they can't get it through the VA, should they go through the county, city, or community health organizations?
Yeah, I would say, given how scarce vaccine is still, go ahead and get it when you have a chance. There's no need for you to wait for VA or for you to wait for your state to give you an opportunity. If you have a chance to get it from whoever offers it to you, go for it. It's the same vaccine that we have everywhere, this Pfizer or Moderna. So I encourage you just go ahead and get it. We won't hold it against you. In fact, we'll say, that's awesome. Let us know where you got it so we can put it in your medical records so we know you got it. So I have no problem with that, and I encourage people to take the opportunity.
Younger vets want to know when the vaccine will be made available to them. Do they follow their state's timeline, or does the VA's variance control when they may have when they may receive their vaccine?
Right. So younger veterans, I guess it depends on who is younger. For those who are 64 and younger, if you have a high-risk medical condition as defined by the CDC that puts you at risk for high risk for severe disease from COVID-19, like I said, heart disease, diabetes, smoking, you can get vaccine potentially in phase 1C of the CDC's recommendation. I think most places are not quite there. I will say that for states and jurisdictions and VA alike. Some people who are 64 and younger who have these medical risk conditions are able to get vaccine, but we don't quite have enough supply yet. We are still moving through the eldest to offer them vaccine first, because age is such a more strong risk factor compared to any of these medical conditions. It's like age is a super duper risk factor. That's why I can't emphasize enough, if you have elders in your family and are eldest veterans, they need to get vaccinated first. They're at an incredibly high risk for severe disease. But I think probably, if I were to predict, our supply of vaccines was to get much better in March and April and May. And by May, I think those younger veterans who have a medical condition should have an opportunity to get vaccinated. Now, the really younger ones, like teenagers, 10, 20, 30, and that's 18 and older, I'm not sure when they can get vaccine. The young, healthy people, probably sometime in the summer. So if you're wondering about your young 25-year-old with really no health conditions, they probably have to wait a little bit longer into summer.
Okay, great. In the interest of time, I'm going to skip a couple questions I think that we've already sort of covered. The next question I think we can just cover pretty quickly. Do veterans have a choice in which vaccine is available to them? I'd imagine whatever is available is what is available.
That's right.
Okay.
most VAs just have one product anyway, so I encourage you to get it because they're both really safe and effective.
Can a veteran who has a VA-approved caregiver be vaccinated?
Yes, if the caregiver is part of the formal stipend program, which is known as the Program of Comprehensive Assistance for Family Caregivers. And you will know if you're a caregiver in that program because you applied and now receive a stipend and support to help care for your veteran. Those caregivers can be vaccinated with us in VA. And the way it works is that those caregivers can ask for a vaccination and receive it at the same time as their veteran. So if they care for a veteran who is 75 and their VA is offering vaccine to that 75-year-old, even if the caregiver is 55, they should just come in and get vaccinated at the same time.
Okay.
So yes.
Great. And I think we can answer this one quickly. It's a non-caregiver spouse and or dependents be vaccinated through the VA. I'd imagine the answer is no.
You're right. They should, I encourage them to look to their state or jurisdiction to find out when it's their turn to get vaccinated.
And finally, can a person still be a carrier after they have been vaccinated?
Probably yes. I think the big thing that we want to know is if you can get sick from COVID-19 after you get vaccinated. The answer is yes, much less chance, and probably it won't be as severe, but the vaccine's not 100%. And I think the thing we do not know yet, which is why we still have to wear our masks and stay socially distant, unfortunately, and wash our hands, because we don't know if the vaccine can prevent transmission. If it gets in our nose somehow and we had the vaccine, can we sneeze it out or somehow give it to others? Maybe. So I think we're still learning about that. Hopefully we'll know the answer to that sometime later this year.
Okay. And finally, if you could give one piece of advice to a veteran, what would it be in regards to vaccination?
Well, I think besides go ahead and get it when it's your turn, I want to speak to those who are not sure. Just because they're suspicious or they just are like, I don't know about that. These are fantastic vaccines. Vaccines save lives. And I'd say if you are unsure for yourself, the vaccine is safe and effective for you, pretty certainly, but think about your family and how much they mean to you. And would you do it for your family? So if you're not going to do it for yourself necessarily, think about doing it for your family. You may protect your grandparent or your parent by doing it. So I encourage you, if you're not sure if you're going to do it for yourself, do it for your family because family means everything.
Great. And now I'd like to wrap up things. First of all, I want to please, if there are any information that you would like to hear more about from our response team, please type it into the chat as we close out. Second, of course, we are in the age of social media, so please follow our social media on Facebook, Pacific Islander COVID-19 Response, Instagram, Pacific Islander COVID-19 for updated information. Third, please fill out the survey provided in the link. This survey will help with the work conducted by the Southern California Response Team. I'd like to acknowledge the many people, first of course, Dr. Kim and Pastor Lynette, as well as our wonderful audience, the great questions that they asked, everyone for spending their evening with us, the Veterans Administration, doing such excellent and needed work. the community engagement work group for planning the talk story series, the Southern California COVID-19 response team for the continued efforts to safeguard our Pacific Islander community, doing not just outreach as far as information, but also hosting testing and trying to get the vaccine to our Native Hawaiians and Pacific Islanders. And finally, thank you to all of our men and women who have served and continue to serve in the United States military. It's so important, even if you're vaccinated, please follow those three pieces of advice. Well, the washing hands, social distancing, and wearing a mask is so critical because we just don't know, as Dr. Kim pointed out, whether or not there is transmission of the virus, and probably it is, even if people are vaccinated. The main point of the vaccines, in addition to stopping in some sense the transmission, would also be to making sure that people don't die and people don't get very sick and have to be hospitalized. I've been in the hospital. There's people who are very young who pass away. There's people with no risk factors who pass away. There's people who have lasting, seemingly lasting effects from the infection. So please wear that mask. Please, physically distance, but socially love. We can have aloha for people, but we don't have to get that close to them. And keep our families, our kupuna, our elders, our veterans safe and alive. Please register for the vaccine when you can. And now I'd like to ask, I'd like to just reflect that this is a time to remember everyone who has given for us and to give to them, to protect our veterans, to protect our elders. We can do that with the means that we have when we're not able to be vaccinated. That is social distancing, washing hands, and wearing a mask. But get our vaccines when we can to protect them as well as ourselves, to protect the people that can't be vaccinated right now. And just again to live life with gratitude and graciousness. I'd like to ask now Pastor Lynette Fuka for a closing blessing.
May God give you for every storm a rainbow, for every tear a smile, for every care a promise, and a blessing in each trial, for every problem life sends, a faithful friend to share, for every sigh a sweet song, and an answer for each prayer. Amen.
Amen. So mahalo, whawhatai, malo pitu, maruru, ke kamal masao, sios mase. Remember www.pacificislanderhealth.org. And I think, team, are we going to stay on a little bit in case people do have any last minute questions?
Yes.
We'll turn off the video part and we won't say anything, but maybe we'll be on for 5 or so minutes in case people have any last minute questions, and we can figure out how to reply to those. So again, please be safe, take care of yourselves. Aloha.
Thank you, Dr. Kawika and Dr. Jane. Beautiful. It was a great presentation. I mean, I think we had a lot of questions going through, and you answered them very well. Hopefully we can post everything out to the community. Dr. Jane, if you could let us know which slides you think we should post for other folks to view on our website.
Sure. You know, if you just want a couple slides, like high points, we can certainly recommend them, or links.
Yeah.
I mean, from my perspective, you're free to share this, you know, maybe in a PDF, the whole presentation if it's helpful to your people. But, you know, we can go through it and highlight a few if you'd like to just hit some high points.
Thank you so much. Did anyone, any of the attendees left that wanted to ask any questions? Just let us know.
I forgot to answer one question. I remember now, it was asked if any of the vaccine education materials are in Pacific Island languages. And I know, and I actually don't know how to pronounce it right, the Filipino language, Tagalog. We have translated it into that language, but not others yet. There were requests, I think, for some Pacific Island languages. I saw Chuukese was there. Haven't gotten there yet, but there were requests. So if we can find a good translator is a challenge, but we are aware, and some people will obviously learn best in their own language. So we'll
Yeah,
we'll
let
have
us
those in
know.
mind.
We have 5 languages that we often get translated: Native Hawaiian, Chamorro, Marshallese, Samoan, and Tongan. So
Oh,
we can help in those
oh,
efforts if you need. Mhm.
oh, well, thank you. That's good to know.
Yeah.
I know it's getting late for you, Dr. Kim, too, because you're on the East Coast, so I want to be respectful of your time.
Yeah.
Oh, thank you. It is late, but I wanted to do this. It was so important.
Thank you so much, and thank you for the work that you do.
Oh, well, thank you for having me. I really appreciate it.
Okay, so we will. Let's see. We don't see any questions.
I think we could probably cut it. I just want to make sure that if there was anyone, you know, maybe
Yeah.
that didn't want to, in front of other people, type in their questions. But I mean, I think it's really important just kind of as a, you know, to keep on thinking about the vaccine hesitancy, because I think Dr. Kim, as you pointed out, you know, we don't have the best record either with Indigenous peoples in general. You know, in Hawaii, we have the whole issues of Hansen's disease and that sort of history. There's a lot of, you know, and in people have been, you know, kind of historically discriminated against. There's, you know, unfortunately, I hear a lot of on Facebook, I see a lot of the, you know, conspiracy stuff. And sometimes it's like, you know, kind of it's sort of the hesitancy is well founded based on history. But I think it's, you know, as you say, we just need to break through that and say, you know, we need to remember the past, but we also have to live in the present and you know, prepare for the future. And the way we prepare for the future is, you know, to be able to vaccinate ourselves and our loved ones.
Yeah, you would think with the elders that they are not accustomed to getting vaccines, but I mean, they had to get the polio, you know,
Yeah.
vaccine. I mean, there's at least 3 or 4 that I can think of that they probably had to do in the past. So it was alarming to hear that a third of the folks saying like they're hesitant. So thank you for that insight, Dr. Kawika.
Okay. Well, I want to wish everyone a good night and thank you again.
Thank you so much.
Thank you.
Bye.
Is there anything else, Heidi?